Dumelang. Ninjani, sabonani. Habari gani? Welcome, 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 welcome. My name is Anne Githuku Shongwe. I'm UNAIDS Regional Director for East and Southern Africa. And with me is my co-moderator,
Sanbonani, Ninjani. My name is Dr. Tembisile Xulu. I am the Chief Executive Officer of the South African National AIDS Council, and I'll be your co-program director for the day. Thank you.
Colleagues, let me begin by acknowledging all the protocols and who is present with us. Let me begin by acknowledging His Excellency Minister Mutsualedi, Mr. Aaron Mutsualedi, Minister of Health, who is here with us. Alongside him is our Executive Director, UNAIDS Executive Director, Ms. Winnie Byanyima, who is also with us in the House. We also have with us Deputy Minister Steve Mapaseka-Letsike, who is with us as well. We have the UNAIDS Global Alliance patron, the Second Lady, Ms. Humile Mashatile, also with us. We have with us the MEC for Health, Nomantu Nkomo Relihoko, also with us. We have the Executive Mayor of Ekurhuleni Metro, Nkosindiphile Kaza. He told us that there are over 4 million people here in Ekurhuleni, so big, deep respect, Mr. Mayor. We also have with us other UN representatives who are with us. I see our regional director for UNFPA. I also see the presence of WHO, of UNICEF, of ILO. I don't want to get into trouble, but any other UN agency that I don't see in the House, I want to acknowledge you as well as our colleagues from PEPFAR, who I see as well, and others from the Diplomatic Corps. I also want to acknowledge the CEO of the hospital, Dr. Lebogang Khumalo, who has given us a wonderful tour of the hospital. The MMC for Health, no, we already have the MMC for Health, I think is also in the House. We have SANAC Civil Society Forum Chair and SANAC Co-Chair, Mr. Soli Duku. We have Professor Helen Rees from WITS RHI, who is with us as well. Dr. Linda Nkomo Ngube, Nelson Mandela Children's Fund. Dr. Tutula Balfour, SANAC Private Sector Forum. We have Professor Mbulela Ndiase, who is the PLHIV sector representative with us. We have other members from civil society, and I want to just acknowledge everyone who is attending. I don't want to minimize anyone who's in the House, but to acknowledge all those who are here, who've taken the time to be present for this global launch. We are live, and therefore want to acknowledge the world that is watching us and recognize that there are more of us here. I want to hand over briefly to my co-chair.
Thank you so much, Anne. Before we go on to sing the national anthem, I'm just going to clarify a few housekeeping rules. Our ablution facilities for our guests are outside on your right-hand side. Outside this door, on my left-hand side, are the ablution facilities for the principals. So if we may keep that place, that space open, because it's also required for security and evacuation services. Before we sing the national anthem, I'm going to ask that we kindly all rise to observe a moment of silence in honor of our former Deputy President and Chair of SANAC, Comrade David Mabuza. He passed away last week and will be buried this weekend. Thank you so much. May his dearly departed soul rest in peace. You may take your seats. Back to you, Anne. So we are all aware that Bab David Mabuza was the chairperson of SANAC. There are multiple memorial services that are happening on his behalf today. The funeral will be this weekend, and he will remain remembered as the chairperson of SANAC, who really championed the HIV and the TB response in his tenure as the deputy president. I'm going to ask that we rise once more to sing the national anthem. Thank you. Okay. Who's singing?
South Africa, South Africa. Seyem, edidipte fanonsien, uns gevergebertes, war die große Antwort hier. Sounds the call to come together, and united we shall stand. Let us live and strive for freedom in South Africa, our land.
Thank you. Kindly be seated. Thank you all for joining us for this high-level launch of UNAIDS Global AIDS Update 2025. This is a report that we release every year with different themes, and you will hear in detail about the theme. This year's theme is AIDS Crisis and the Power to Transform. In previous years, we have had in 2024 the urgency of now, the path that ends AIDS, communities at the center in another year. Every year we pick a theme that is pertinent to the issues at that time. We have an exceptional list of speakers with us today. So in the next 60 minutes, you'll hear from the Minister of Health of South Africa, you will hear from the Executive Director of UNAIDS, you will hear from our MEC, our Mayor, you will hear from our patron, the Second Lady of the Republic of South Africa, civil society, young people, researchers. We will focus on the powerful partnerships between UNAIDS, governments, and communities to hear how together we have the power to transform and end AIDS by 2030, despite the funding crisis. The funding crisis has been faced by many countries in our region and across the world, and we are here to listen to the results of this report. Let me hand over to my co-chair for our next speaker.
Thank you so much, Anne. So you'll note that today's program is divided into three parts. The first is a welcome address by the provincial executive, the executive mayor. The second part of the program is a panel discussion. And then the third and the last part will be messages of support from civil society, from the private sector, as well as from government. And then we will conclude with a vote of thanks. I just want to acknowledge that this is the second time that South Africa has been asked to host the launch of this report. The first time it happened was in 2019, where we hosted Eshowe, and that was in the King Cetshwayo district. That was one of the first districts to reach the 90-90-90 targets prior to the end point. So halala South Africa, halala. Thank you very much to UNAIDS for actually choosing us to be the host of this report. And on that note, Baba Umeya, Babu Kagaza, may we please ask you to come and do welcoming remarks. Thank you. Please, a round of applause for the mayor and the MEC. Thank you.
Thank you very much, Program Director. And I think according to just the protocol, we allowed the MEC to actually welcome us. But welcome to the city of Ekurhuleni.
Yes,
we will do the vote of thanks. Thank you very much.
Thanks, Mayor. Thank you, Mayor, and let me greet the program directors. You can see, DM, that Mayor knows that he will be recalled if he doesn't do this today. I have all the powers. Thank you, program directors, Dr. Temsile Kulu, who is our SANEC CEO, and Madam N. Jituku Shongwe, the Director of UNAIDS Regional Support Team for Eastern and Southern Africa. Minister of Health in the Republic of South Africa, Dr. Aaron Mtswaledi, Deputy Minister, who's here with us, and thank you so much for the support, DM, that you always give us in the region and in the province. Executive Mayor of Ekurhuleni, Councillor Nkosindipile Xhakaza, our second lady in the country, Mme Mashatile, UNAIDS Executive Director, Ms. Winnie Bainyima, Patron of South Africa Global AIDS to End AIDS in Children, Ms. Humile Mashatile, Siyabonga Sisi again. Thanks for the support. I know we have programs that you said we must do together in the province, and we are ready to do that. Our moderator, Ms. Lerato Mbele, panel participants, distinguished guests, civil society partners, that is led by the chairperson, Gladys Chabalala, who's amongst us, faith-based leaders and colleagues, officials from various spheres of government, including my CEO, Lebu. I hope we have showed them all the best places at Bethaklo. I've been telling Minister about Bethaklo, our hospital, and I hope you didn't disappoint, because Minister is going to hold me accountable for that in the NHC. Ladies and gentlemen, good afternoon. It gives me a great pleasure to be part of this historic occasion, which marks the launch of the annual UNAIDS Global AIDS Update Report. This annual event, hosted in various countries across the world, has become a very significant occasion that serves as a reminder that the fight against AIDS, HIV and AIDS is a relentless one, which now more than ever before must be sustained. Gauteng carries a big part of the HIV burden, but also the power to lead. We are proud to have achieved 94% of the people knowing their status, with 83% on treatment and 93% virally suppressed. But we know that the second 95 remains our biggest challenge, especially young people and men in particular. As a province, we are among the first to launch the 1.1 ART GAP campaign, where we aim to put over 326,000 people on treatment. We are taking this campaign to universities, to townships, to informal settlements, and to hostels. We are reaching communities through a multifaceted approach that is involving weekly radio slots and corner-to-corner campaigns, amongst others. Our mission is to ensure that no one is left behind. Despite the funding cuts that forced some of our NGOs to either scale down on their work or close, we continue to work with civil society, launching including the Gauteng AIDS Council to keep the momentum strong. And we have expanded youth zones, trained over 200 new HTS counselors, and deployed mobile clinics to reach to the most vulnerable. And Minister, what we have done now is to go to the taxi ranks. We are now building clinics in the taxi ranks. The first one that we have done in partnership with Empathy, it's in Orange Farm, and we will take you there because the men in that taxi rank, they were very appreciative of the initiative of building the clinics right to where they are, because they are saying they've been scared of going to the clinics or hospitals because of the stigma. So we will take you there so that you can see when we roll it out even to other bigger taxi ranks, as they have been asking, because we're working with the taxi associations again in the province. So as a convener of faith-based organization on behalf of the Gauteng provincial government, I've been mobilizing the sector to also play a more impactful role in fighting the stigma and encouraging hope. Thank you to UNAIDS, SANEC, and all other partners that have been working with us. Your support reminds us that this fight is about people, not just numbers. Together, we will end AIDS as a public health threat. To UNAIDS, thank you for choosing to launch this global report in South Africa and especially in Gauteng. Our province is a critical battleground and a strong voice of universal health coverage and the full implementation of national health insurance. We are committed to do our part to ensure that we contribute towards the goal of achieving UNAIDS 95-95-95 targets and to end HIV/AIDS by 2030. Thank you. Ndiyabonga. Thank you.
Thank you, MEC. And before I lose my job, MEC, I would like the people to know who was addressing them. So this is Umama Unomantu Nkomoralehuku, who is currently the MEC for Health and Wellness in Gauteng. And she's also a newly elected member of the National Executive Committee of the ANC Women's League. I'm saying this because she is the only MEC who runs a Department of Health and Wellness. We were discussing this with the minister earlier, that health does not begin at the entrance of a facility. There are so many social determinants of health, and a lot of them have got to do with our wellness and our well-being, starting within the societies where we live and just the basic food that we consume. We are going to proceed with the second part of our agenda, and I'm going to hand over to Anne to announce our panelists. Thank you.
Thank you so much, Dr. Xulu. Let me start by inviting Ms. Lerato Mbele, who's our South African journalist. She's our moderator for this panel, so if I can invite her up. I think she's well known, has been on the BBC, worked with Africa Business, Newsday, Report and Newsday, and other many well-known journals. Lerato, I think I'll invite the speakers, or do you want to do that? I can do that. So can I please invite the speakers to come up on stage? If we can have Dr. Aaron Motsoaledi, Honorable Minister of Health of South Africa, to come up on stage, please. Ms. Winnie Byanyima, Executive Director, please come up on stage here. Can we have Ms. Joanne Betty Wani, who is Program Coordinator for Adolescent Girls and Young Women's Network in South Sudan, also to come up on stage. There are stairs on the left, on my right and on my left. Reverend Mbulelo Jasi, Executive Director of Sanarela, please come up on stage. And Professor Helen Rees, Executive Director of WITS RHI. Sis Lerato.
In the middle, ma'am. Next to the minister. Reverend over here. Thank you very much to the program directors, and thank you very much to the audience for gracing your presence. And also, I hope these microphones hold up, and also thank you very much to our audiences online watching via stream. conversation. May I request that our panelists keep your submissions succinct? That way we can have more of a dynamic flow. It's to me that the microphone required me to be facing forward in order for the sound to be retained. Perhaps that's also true for the rest of you. So my name is Lerato Mbele, and as we discuss the global aid crisis and transformation, I want to just statistics. Should somebody fix it, please? Let's see if we can borrow. Thank you. We are sound checking, courtesy of the Minister of Health. Thank you very much. We love a multi-talented member of the executive. Thank you, sir. All right, so as we discuss today's global update and the theme AIDS crisis and the power to transform, I want to just go through a few statistics which will be elaborated on by the executive director, but just to really remind us the path we have traveled. 40%. That's the decrease in new HIV infections, and that number stays consistent. 56%, a decline in the rate of deaths that are AIDS-related since 2010. 62%, the percentage drop in mother-to-child or vertical transmissions in the last 15 years. And 75% or 3/4, the number of people living with HIV worldwide who've been able to receive antiretroviral therapy and treatment. I'm reminding you of these statistics because whilst we are confronting a confounding situation of a funding crisis in 2025, in the past 15 years, there have been huge successes and strides. Yes, the COVID pandemic added a complicating variable, and the events of 2025, the unilateral cuts in funding, definitely complicate the picture. But it has been done. The hard yards do reflect in the numbers. And so in our conversation right now, we will reflect on the crisis indeed, but can we talk about our collective agency, our social capital, corporate citizenship, policy alignment, the things that will get us over the mark in 2030, where we hope to eliminate AIDS as a pandemic and align also with other achievements of the UN SDGs. And so with those words, may I hand over now to Winnie Byanyima, the Executive Director of Global AIDS, of UN AIDS, to talk us through the figures in the global update. Ma'am.
Thank you very much, Lerato. Can you hear me through this?
Yes.
Good. I must first recognize the Honorable Minister. Wait. My papers. I must first recognize the Honorable Minister, Dr. Aaron Motsoaledi, and through him thank very much the government of South Africa for accepting to launch our annual report, the Global AIDS Update. Thank you very much. I also recognize, thank you. I also recognize my friend, Deputy Minister of Women, Youth and People with Disabilities, Ms. Steve Letsike, thank you for being here. I recognize our patron of the Global Alliance for AIDS in Children, Second Lady, Mrs. Humile Mashatile. Thank you also for the role you play. The Gauteng MEC for Health, thank you for your opening remarks. I recognize too the Executive Mayor, thank you for being here too. Chairperson of Civil Society and SANA Co-Chair, and of course our gracious host, the CEO of Beta Gotswe Hospital, Dr. Kumalo. All of you distinguished ladies and gentlemen, thank you for being here. Let me send my condolences also to the family of the former Deputy President David Mabuza, whom we worked with all these years until he stepped down from that role. Thank you. The data in this report, this year's report, is for 2024, last year, up to December last year. But it also touches what has happened this year, because there's been a major disruption this year. But the story up to December last year showed remarkable achievements. Some of them, Loretta has told you of, how new infections were declining, AIDS-related deaths were declining. We were not completely on target, but the direction of travel, particularly for this region, but even globally, was good. The story is one of the most successful public health responses in history, saving more than 26 million lives, showing what is possible when the world comes together to fight a disease. But the report also shows that we have gaps, that on the prevention side, we had 1.3 million people who were newly infected last year in the whole world. And that, as I said, the report touches what is happening, what has happened this year, that the sudden withdrawal of the single biggest HIV donor, combined with other cuts of aid from other governments that were happening more gradually, is putting this progress at risk, particularly for the low-income, highly burdened countries, again, mostly on this continent. If the world doesn't plug this hole, we estimate that an additional 6 million people will be newly infected in the next 4 years. So we had 1.3 last year, but between now and 2029, we could have another 6 million newly infected, and we could have 4 million additional deaths, AIDS-related deaths. Last year, the number of deaths was 630,000 across the world. So we see that this is a serious disruption, but we also see that countries, governments, and civil society are not lying down and waiting to die, that there is action, that there is transformation. We also see that the impact of this disruption, that the disruption itself is not just financial. We also see that there is a backlash against rights, laws, policies that create that enabling environment for people to come forward and get life-saving services. This is happening across the world. We see for the first time, we started compiling these reports, for the first time, the number of countries that criminalize same-sex relations or gender expression have increased for the first time. So we see that punitive laws, punitive enforcement of criminal laws is increasing. So we see that people who should come forward for services are also not coming forward because of this backlash on rights. So, as I said, we have the power to transform, and we are seeing efforts by governments, by communities, to move forward and plug this hole. We sampled countries. We found out of 60 countries, 25 were talking about or planning reallocations. Some have created new sources of domestic funding, like levies and so on, to push forward to fill their gap. We also see more cost-effective ways of delivering services as governments integrate HIV into the mainstream of health service delivery. We see more cost-effective ways to deliver. Comes with risks, but those are things to discuss about how to fight stigma and discrimination in those contexts, and how to keep communities served. So, Loreto, I could go on, but I know that we need to hear from more speakers. Those are some of the highlights, that we need to keep the global solidarity. It's a global disease. The fact that it is festering in one part of the world and in other pockets of other parts of the world means that it's not over. We need the global solidarity to keep fighting together, and developing countries are putting their foot forward. Rich countries must also maintain support to end a global disease. Thank you.
I'm really struggling with the microphones, but we'll get it right. Thank you so much, Winnie Byanyima, Executive Director of UNAIDS, for reminding us about the importance of global solidarity, checking also social stereotypes and how they impact on the ability to mobilize communities, and also the importance of aligning public policy. It's not just about money. Let's bring you in, Honorable Minister of Health for the Republic of South Africa. If there's one thing about you, you're very candid about the challenges faced in public health in South Africa and the demands of the public health system in the country. But what we do know, South Africa has one of the better funded public health networks on the African continent, and by and large, it was said that more than 75% of the HIV and AIDS response was funded by the South African Treasury. So even though there have been exogenous shocks in the form of cuts from USAID and PEPFAR, South Africa felt that they could fill the gap. And yesterday was that incredible announcement by yourselves and the National Treasury as to mobilizing close on to R1 billion towards additional HIV support. Could you tell us about the horizon for South Africa and the treatment and the intervention and your response? Tell us about the wonderful work you're doing, Minister.
Sorry? I missed the last part. Can I tell you about what?
I think you just want me to hear you say, tell us about the wonderful work you are doing, Minister.
Everything about our work, okay. That will need about 2 hours. Thank you. No, thank you very much. Yes, I'm sure all protocols have been done to everybody inside the house and including my fellow panelists here. I don't have to repeat that. I think you are aware that by and large, we are the country most affected in the whole world. I don't like that tag, but it's there, it's a reality, it's living with us. And for that reason, that's why in 2010, we came here to this very district of Ekurhuleni and launched the world's biggest HIV counseling, testing, and treatment campaign. It became the world's biggest. And so at the moment, we are having 5.9 million people on ARVs. We're not very proud about being number 1 in the world. And for that reason, we want to be proud to be number 1 in fighting the disease, to reverse what has happened. And we've made quite a number of strides. To me, the most important one is the increase in life expectancy.
May I interrupt? May I ask you to just hold up the microphone closer to your lips? There we go.
Yes, the most important one is the increase in life expectancy. I was very proud when our life expectancy increased to 66 years, when one of the foremost AIDS activists and researchers and Professor Salim Karim, equated it to the emancipation of slaves. That the effects of that increase is like what happened when slaves were emancipated. I was very proud of it. The second figure we are proud of is a massive decrease in maternal mortality. At the time we started this project, our maternal mortality was 240 per 100,000 live births. You can imagine, because women were receiving the brunt of this disease more than any other. Women and children, but we're worried about a higher maternal mortality because you know what it does to a nation. And I was telling people that maternal mortality is not just about death, grief, and health. It's about the development of a country, because no country develops with a higher maternal mortality. So I was very happy that it has now decreased. It went to 109,000 just before COVID, and jumped again to 119 during COVID, but it coming down again. It was just caused by COVID to cause that, that jump. Now, we are very happy of that. The other figure we are very, very happy and proud of is that we want South Africans to remember this. By 2004, 70,000 children were born HIV positive every year, and we reached a figure of 70,000 by 2004. When we checked at the end of March, the number of children who are born HIV positive has decreased to 634,000. I thought you'll pat yourself in the shoulder for that. You will applaud that, honestly. Moving from 70,000 to 634,000, it's not a child's play. But that's exactly what we've been able to achieve. So for this reason, yesterday in Parliament during my budget speech, I was telling members of Parliament that South Africans must not get used to the idea that we've got HIV and AIDS and TB and they are there and they are being treated, there's a budget every year, and we are prepared to live like that forever. We must start thinking about elimination. We must start thinking about getting rid of this disease. And it's within our reach. Yes, it's within our reach, and that's exactly what our plan is. And my budget speech yesterday was outlining that plan towards eliminating HIV and AIDS. Right. I was talking to Mama Winnie here. Yeah, Winnie is a very powerful name in South Africa, for your information. And Mama Winnie is a very powerful title, for that matter, in our country. And I was talking to her that diseases like smallpox were never treated, but we were able to get rid of them. Many people don't even know what you're talking about when you say smallpox. Why can't we do so with HIV and AIDS and TB? Why can't we do so? And why can't our plan be all in that direction? Yeah. Thank you very much.
And I'm grateful for the analogy of smallpox, because it's not only about money, is what you're saying. It's also about advocacy, community engagement, and people just being determined. And so maybe this is a good opportunity for me to bring in Betty Wani, Juan Betty Wani, and we call you Betty, is what I've been told. And you're the program coordinator for Adolescent Girls and Young Women's Network in South Sudan. The Honorable Minister has just said, in the early days, when people were trying to figure out exactly what is this HIV and AIDS, the largest component or demographic of people who were infected were women. And so work has been done over the last decade to really target treatments and awareness for women. And yet in a country like South Sudan, this is where the greatest vulnerability lies. It's the girl child who can't negotiate their sexual health with regards to their partners, and a society that still stigmatizes HIV. So in terms of a country like Sudan, and also the ensuing issues around conflict and instability, how does that complicate the response to HIV and the work you do?
Thank you so much.
We can hear you, Betty. Let's see.
And thank you so much, Loreto. Let the protocol all remain observed. I'm Joan Betty from the Republic of South Sudan, working with Adolescent Girls and Young Women Network in South Sudan as a program coordinator. I would like to first take you through South Sudan, what South Sudan is. South Sudan is a country with closely 12 million of population countrywide. Over 9 million of the population are people with humanitarian concern. Around 400,000 people are living with HIV, but only 51% of the people know their status. The ATR coverage is only at 47%, with 8,100 new infections in 2023. New infections reduced by 45% since 2010, which is still way below average in Eastern and Southern Africa, where there is a 59% decline in new HIV infections over the same period. In 2023, There were twice as many new infections among women aged 15 and above compared to the men. Inequalities stem from persistent levels of sexual and gender-based violence. A study conducted in 2027 by the Global Women Institute and the International Rescue Committee indicates that 65% of women and girls have experienced physical and sexual violence in their lifetime, and over 51% have suffered intimate paternal violence. I would like to take you on the humanitarian context of South Sudan. It was just yesterday, which is 9th of July, 2025, the Republic of South Sudan celebrated its 14 years of independence. Over the past 13 years, we have been suffering with civil unrest despite the 14 years of celebration. As a result of this, high levels of humanitarian needs affect a large population, and also girls and young women particularly are vulnerable to HIV infections. In South Sudan, under the humanitarian context, there is a lot of insecurity, in a way that there is a lot of political instability, there is intercommunal conflict, and there is a lot of natural disaster, which is like the floods. This interrupts the docents from accessing services in form of education, health services, and also leads to early marriages in the context of the humanitarian context. So it makes it difficult for the docents to get services. I can give you one of the example. We as the peer educators, we had one of our adolescents that happened to share with us her story during the displacement and the political instability, how they separated from the parents. And she ended up staying with the uncle. So the uncle was too much into wealth. So the uncle gave the girl to someone who was rich because the uncle wanted to gain the wealth. The lady was 13 years old, and she was forced by the uncle to get married to a man that she is not aware of his status or about his well-being. So during that process, the lady got pregnant, and the man was HIV positive. She was too young to give birth to a kid who was around 3 kgs, making it difficult for her to produce. So she went for a labor period of around 1 week and 3 days. The addressing girls and young women vulnerability, we look at also the incidence of the poverty, that is economic insecurity in South Sudan. We are facing a lot of economic insecurity as adolescents in South Sudan, where most of the ladies are now going through transactional sex as a way of survival for them to get something that can sustain their living. Then when you look at the culture also of South Sudan, we are facing a lot of issues when it comes to culture. In our culture of South Sudan, women's dignity are not being respected. It is a taboo for someone to speak about the use of condoms, even for you to go and get family planning without acceptance of your husband. It is a taboo. You're supposed to first get a permission before and you go and get the family planning method. So it really makes it difficult for the adolescent girls to go and get services. And there's also a lot of issue when it comes to stigma and discrimination. Most of the ladies who are having HIV, they really fear to go and get service because they have that fear within the community or maybe within the facilities where they're going to get services from. Maybe there's a story of one of our peers also who shared with us how she's HIV positive because she got it from the parents, and it was really difficult for her to study in school. Every school that she goes to, people know that she's HIV positive, and people fear to interact with her because of her status. So the parent kept on shifting her from one school to another, and she ended up even leaving school because of the stigma.
Yeah. Betty, if I may interject there, just for us to just process what you've told us, because clearly issues of culture come into play. There's the intersectionality with poverty. It adds to the vulnerability. Flooding, erratic weather patterns, climate change adds to the material condition as well. And then, of course, young girls being able to negotiate their futures when sex is transactional and child brides that problem remains prevalent. I think we just need to digest that a little bit. And perhaps let me bring you in Reverend Mbulelo Jasi, Executive Director of Sanarela, the South African network of religious leaders living or personally affected by HIV and AIDS. I mean, we're talking about some of the challenges that young women are facing in other parts of the world. And I'm sorry to say, the context is different in South Africa, but I think young women would also argue that they find it difficult to negotiate their sexual rights in relationships. So when we are talking about these social issues and societies that still stigmatize people who are HIV positive, or where there's difficulty in accessing treatment, what is the role of social advocacy, community groups, in raising awareness, in creating inclusion and understanding? And as I ask you this, I also want to refer to something that comes out of the report. I gave you all those statistics as to the successes and more people on treatment. But the report has also found that within the patient profile of people who are not on ARVs or other treatments, it tends to be men. Why is that?
I like my language, isiXhosa. Sivele sithi molweni. Sesi observe ki protocol. Thank you very much, Comrade Lerato. Of course, as a sector of people with HIV, we are worried. We were frustrated as well, especially, where is PEPFAR? Where is PEPFAR? PEPFAR, raise your hand. Where is PEPFAR? We are worried, especially with the withdrawal of PEPFAR, because really this whole process could reverse the gains. You know, we have done a lot in this country. We've tried our level best even to fight stigma and discrimination. But we're worried about the services for adolescent girls and young women and other populations that could get infected with HIV. We tried to fight stigma, especially with SANAC sectors, and we're very close to Department of Health in addressing some of these challenges. There is a men's sector at SANAC, for instance, partnering with men's forums throughout South Africa to ensure that men are coming back to care. We even created a Better Men for Tomorrow campaign to ensure that men are mobilized in this country. But Minister, I'm not buying your face. Thank you with Honorable MEC. I'm still getting my ARVs. There are no problems. Yeah, there are no problems. Whether PEPFAR is there or not, I'll get my ARVs every 3 months. And this time we're refusing to die. This time. If West and Europe, they're expecting to see us dying, not this time around. They must forget, we're refusing. So we'll make sure that we regroup to continue the work. We don't have a choice. And this time we need to prioritize. We need to come up with priorities, not to address everything. We need to make sure that we zoom in and really make sure that our priorities are making sense. This time around, I must make this panel. I want to assure you that as sectors of SANAC, we are now equipped, we are even capable of doing this work with or without your money. So, if PEPFAR you decide to come back, you'll find us working. We won't stop this work.
We love the conviction. Thank you for that. All right, so let's bring in Professor Helen Rees. And first, let's congratulate you for having been awarded the Dr. Lee Jong-wook Memorial Prize for your work in public health. And it's important because it means, like others, you've been at the coalface, but on the data gathering and research side. And when we talk about funding cuts, it's not just from the pharmaceutical medication therapy side. Would this also impact the research and data gathering side? Because one of the reasons that Reverend Jassy can take his ARVs every 3 months is because of medical advancements. And there are other innovations as well, like pre-exposure prophylaxis, that has been championed in countries like South Africa for young people to sort of think about how to prevent themselves from contracting HIV even before they socialize. So there's a lot of that work that's being done. How will it be impacted by the funding cuts?
Well, is this microphone okay?
It sounds okay to me. I don't know about the audience. Can we hear Professor Helen Rees?
Is this one better? Yes,
There
I
we
think
go.
so. So first of all, I know we say all protocol observed to our ministers and our deputy ministers. I want to say something else about protocol, because I'm listening to our speakers here, and I know people in the audience. I want to respect 30 years of activism from many people here in this audience, which has really changed the face of HIV. And I think as we're thinking about the strides we've made, and we have made huge strides, that was on the back of probably the reference point globally about what is good community activism is HIV. And that was what got access to antiretrovirals, and that is what has continued to push the agenda, and we mustn't stop now. We must continue. So just in terms of your question about the importance of funding and what the funding cuts will mean, well, I think globally, and I'm thinking particularly about the African region, the funding cuts will have a huge impact, and not just on HIV, but because so many other humanitarian aspects of support were funded by the generosity of many countries, and particularly the US government. And I think when we're thinking about the impact of those funding cuts, including HIV, we must just remember that HIV isn't just a disease. It's a disease that in itself, if untreated, exposes individuals and populations to many other diseases. So it has a row of skittles effect. If you have people who are chronically ill from childhood to old age and you can't treat them and you can't prevent the infection, what that impacts on is development. Development impacts on stability and security. So I would just want to start by saying, let's think about that when we're thinking about the generosity of countries, that it's about a disease, but it's about development, equity, and humanitarian. In terms of research, we've had huge support for research from many structures, including from the US government. You've heard a lot about the National Institutes of Health. And we're very much hoping that those relationships will continue. The research that's been done for HIV, for TB in South Africa has had not only an impact for the country, but huge global impact as well. Solutions for treatment, solutions for prevention, solutions for community interventions. We need to continue those partnerships because they are a global benefit. And we can't have a pandemic treaty that we all agree to and then say, let's stop the research. Those two things must go together. And for prevention, we must also say what is the next step after research, and that's access. We now have really great drugs, potentially, that can stop HIV infections, and we need to be able to access those drugs at an affordable price so we can roll them out.
You know, the report refers to the world having been on the brink of a treatment revolution. I wonder if you can just speak to us very briefly about that. Is that the scientific breakthroughs that we are seeing, how close are we to finding a solution that doesn't need money, perhaps?
Well, I think in terms of treatment at the moment, we've gone from the original days where people had to have cooler boxes and multiple tablets several times a day, to single doses of drugs, to combination drugs. But what we're now moving on in terms of the research world is cure. Vaccines have been shown to be very hard to develop for HIV, so we are still a long way, but that research agenda must continue. And what we do have are really good prevention drugs, but as I said, we can have good research findings, we can have good products, but the next thing we have to do is roll them out to the people at higher risk who need them.
All right. Winnie Bianima and Minister, I want us to move the conversation along now because we are dealing with a very real funding crisis, and the report shows that 80% of the AIDS response in African countries is externally funded. I think it's 66% in the Caribbean, 60% in the Middle East. So Africa, a large proportion of how African nations are managing it, does need some kind of external funding. Now, when one country makes a unilateral decision to cut funding, PEPFAR, USAID, it feels like the center of gravity has shifted. But has it really? How else can we think about funding? Because there are many countries that have been able, as you said, to keep standing regardless.
There we go.
Thank you for that question, Loretta. You know, it's true that this region, Africa, particularly sub-Saharan Africa, has been the most dependent on external assistance, but it is also the region that has been making the fastest progress against the disease. It's the region with the highest burden of the disease and the region with the best innovations. Now, with this cut, taking away money suddenly, first of all, it raises the question of the quality of the relationship. You don't just walk away. You plan gradual transitions. Just the fact that a donor can walk away, one member can walk away with no notice, tells you that something was wrong in the relationship. The global solidarity was not on a firm basis of solidarity. So, do you want to stay in that kind of relationship? Not really. You have to start thinking about new ways of sustaining the response. First, it's important to keep global solidarity because it's a global disease. We don't even know where this disease started, but it was global. The fact that it is not ending here as fast as it has been controlled in rich countries is because they had resources, technology, and so on. But as long as it festers in some parts of the world, it will come back to hit everybody else. So solidarity is important, and it must not be confused with charity. This is not charity. This is solving a global problem together. South Africa, this country where we are, contributes to its own response, gets a little from outside as well, like 15, 16%, but also contributes to global solutions, as Helen has just said, in research. The research is for the whole world. So every country is contributing, its hospitals, its clinics, its institutions, its health workers, and what comes in from the external adds to what governments have put down for themselves. Now, we always knew that the relationship was not good, and now it is fraying. So what do? You stop the analysis inertia, going on and analyzing what has gone, you get into the solutions. This is what I say to Africa. The solutions lie in reallocations, even in the middle of these fiscal constraints. You must save lives of your people. Secondly, you must find more cost-effective ways to do this. Some of the programs that were being funded externally, let us be honest, were very capital intensive. They were not scalable. Our poor governments could not do those gold-plated programs that PEPFAR was running. That's the truth. They were great, they had good results, but no government could afford them. So a government that now has to lay a plan of an affordable way. Thirdly, there are new prevention tools that could get us down to 0 new infections very fast. We have to get them. They must be affordable, they must be accessible for us. We need the whole region to speak up, to lead a movement like you did here in South Africa, to bring the prices of ARVs down. You led a global movement with President Mandela to bring those prices down. The companies didn't want to. We need to get these new drugs, 2 injections in a year for a young girl here in Africa. She'll be free, she will not get infected. We will end we're talking about elimination, that is a route to elimination. Once you are not getting new infections, then you have a few million people to stay on treatment, to adhere, not to transmit, and you are towards the end. So we have the possibility of ending this. We need to get prices down. We need to produce the medicine here for ourselves and roll it out. We can end this disease. We can do it within our own resources, but the rest of the world must not get off the hook because this disease is global. It was not invented here in Africa. We all need to put our all hands on deck. Thank you.
Yeah, I've got mine. Yeah, look, I want to regard this moment as a wake-up call. A wake-up call. Because whether we like it or not, it is the responsibility of every government to provide for its people. It's not the responsibility of other governments. I understand the issue of solidarity, but every government on this planet has got a responsibility to provide for its people. That's where it must start, which means there must be very clear political will. Because I agree with Mama Winnie here, that this type of relationship where we depend on one country, and when the country is in some negative mood, the whole world collapses. Yes, it's scary. In fact, I was asking myself, how did we arrive here, where all of us depends on one country? Yes, because when this announcement was made, I was boasting to my cabinet that, no, don't worry, we're buying our own ARVs to the tune of 90%, which is good. I said the other 10% is funded by Global Fund, which is true. And I said that is not touched by PEPFAR. And I was proudly saying that. Only to discover that 1/3 of PEPFAR funding, of global funding, is from PEPFAR. And I was, here was I, no, don't worry, Global Fund is still with us, 10%. Then Global Fund said, by the way, and I was asking myself how we arrived there. Now we've received a letter from Global Fund that because PEPFAR is pulled out, part of the 10 billion rand which we're getting over 3 years, about 1.4 billion will no longer come. What do we do, as Reverend Diaz has said? Roll out and die. No, we can't allow that. We can't allow that. That's why we've been working around the clock. And I also want to state that it's not about the country being rich. I'm quite convinced about that. Let's go back to the history of this pandemic. There was a time when in South Africa we were lost and not providing ARVs. Next door to us was Botswana. We're not richer than Botswana. They are the first to provide ARVs. And they did so long before we even started, even though we are a bigger economy. And at that time, the economy of South Africa was doing very well. We had access, funds and all that. The other country that went in the starting blocks before us is where Mama Winnie is coming from, is Uganda. They also started ARVs before us. And we are still a bigger economy than them. So we can make a start. And this is what I want to promise you and the world. When I said we are going to get rid of this disease.
Right.
There is hope. There is hope of Lenacapavir. There is hope. That is going to change the game. It's a game changer. And I can promise that we will move mountains and rivers to make sure that every adolescent girl who needs Lenacapavir is going to get it. I'm making that promise, I made it in Parliament. Because it's a game changer. Once you do that, because it's prevention, can we imagine, we've already started putting up a plan of how many young girls, numbers and all that. We already have that and we're planning. And when you ask me where we're going to get the money from, I'll tell you this. In 2010, we were asked the same question. When we said we'll test 15 million people and put them on ARVs, we were asked, where can you afford it? And my answer is, can we afford not to? I'll give the same answer today.
Betty, I just want to bring you in very briefly, because we're talking high-level policy, research, but at a personal level, what have the funding cuts meant for the work that you do? Yep. Go ahead.
Thank you. Thank you, Loretta. The reason as to why I can look at the funding has really brought a challenge to us as the adolescent girls who are working with their peers. The reason, when you look at the context of South Sudan, and I look back at the challenges that we are facing basically in South Sudan, and that was the reason as to why we had to form the network of adolescent girls. We formed this network 4 years back. It was in 2021, that is when we formed the Adolescent Girls Network, to work closely with adolescents within the areas and the states, because South Sudan is wide, and to empower the girls, to protect them from HIV, to protect them from gender-based violence. And we work closely with the peer educators to reach the adolescents, to provide for them information through awareness. We also work through like the WhatsApp group, peer educator, community, and radio programs to reach those ones who are being affected by the war, like the Sudan war, those ones who are now in the camps. We use the radio station to work with them. Then the funding cuts, really, our peer educators have become volunteers. They are no longer working. We don't have something to support them. They have the love of supporting the adults in the state, those ones who are facing a lot of challenges on GBV, HIV, but we don't have something to support them. And for you to go to other states in South Sudan, we use the plane, and it is like 2 hours flight for you to reach that side. So now we are operating just within the central, within South Sudan there. The impact of this termination of the funding has been like over 98% of the adolescents have lost their jobs. As funding is pulled back, key services like outreach, HIV testing, and safe space disappear overnight, just like that. And most of the offices were closed because we as adults, we are renting. We are renting offices, and we don't have something that can help us maybe to pay as we are renting and as we are doing our work. And also, there is a lot of increased cases when it comes to GBV and HIV. It is rising, which is because of the termination of the funding.
Right. Okay.
Thank you.
All right, so, yes, ma'am.
Thank you. I'd like to add on what Betty has just said. Thank you so much for spelling out so well how your really life-saving work for girls and young women has been heard. Our report shows that the impact of this sudden cut hit prevention even more than treatment, because a lot of prevention programs, prevention like she was doing for adolescent girls and young women, prevention for LGBTQ people, this work was heavily funded externally. PEPFAR alone was doing testing amongst these most vulnerable people. 84 million people, one program. 84 million people globally. So the message we have to governments is step up on prevention. Don't drop it. Don't focus just on treatment. Support social contracting of communities, of youth groups, of community groups to continue serving their people with prevention programs. They're very critical.
Right. I'd like to wind the conversation down, and I'm going to refer again to some detail that comes out of the report, but I'd like us to think about how to circumvent this crisis, and I'm going to start with you, Professor Helen Rees. The report shows that 25 of the 60 low-income countries featured 25 of those have introduced different spending models. So I think this goes to the issue of, do you spend on treatment or do you spend on advocacy? If you are doing advocacy, which targeted groups? So it's really about thinking outside the box. For the work that you do, what does that future look like if we don't just focus on the money problem, but we focus on solutions?
I think we've got an incredible opportunity here. Let me try another one. We have an opportunity here because with every crisis comes an opportunity. And as Mawini said, we now have a chance to step back and say, what do we do? And we have to accept that worldwide money is tight. It's not just poor countries, it's all countries. So what do we do? What have we learned? So I think the first thing we have to say is, what is the best return on investment? What are the programs that are going to give us the best return on investment? Certainly continuing treatment, keeping people in care, and then preventing new infections. That's clear. But I think that the other thing, and we've been talking about this with the minister, is to think differently about how we're delivering services. Many of these countries, we're talking HIV, but it's about health services. So we need to rethink about the intensity with which we deliver services and the inefficiencies. Can we leapfrog other technologies, AI technologies, so that we actually start to have efficiencies which also generate data, which in turn allow us to deliver better services?
Fantastic. Reverend Yasi, the same question to you. You work with the community, you work with men, you work with those receiving treatment. Regardless of the money problem, what can be done better as we really steam ahead to 2030?
Let's continue to work together. South Africa is a country of structures. And those structures are well coordinated at SANAC. But we people are safe inside clinics. People are not afraid to go to clinics. Fortunately, I'm sure you are aware that there were pastors in this country who used to claim to cure AIDS. But because now we're working with the Department of Health in Gauteng, I want to make an example. MEC Nomantu, she's in partnership with faith-based organizations, for instance, including chaplaincy, to ensure that pastors are trained. Because we discovered that the reason why there was the chaos, people claiming to cure people on TV, is because people were lacking training. Now pastors are trained, pastors now are chaplains in hospitals who are no longer disclosing people in those wards to say, fire! Fire the spirit of HIV. We are no longer doing those things. We are very smart. We work with doctors. We used to share resources in this country. I mean, if there is a resource from Ubabu Solinduku, let's partner with him. There's no reason, we're not going to close down our offices because of funding. We'll continue to operate. Thanks.
Betty, I'm going to ask you to share your views on just transformation going forward. What can be done better?
Thank you, Loreto, for this question. As far as the adolescent girls in South Sudan, we are mostly being supported by the donors. Our government is not supporting us at all when it comes to issues of HIV, gender-based violence, something like that. So what we really need the funding back. It should come back to support us. We need continual global solidarity to ensure we are not left behind and the gains in the HIV response are not reserved. We want access to all the new HIV prevention technologies which can accelerate to end the AIDS by 2030. I would like to also integrate the HIV and the gender-based violence services in the humanitarian context. We need to build resilient communities-based systems that can withstand the disruption of the conflict and other emergencies. I also need like new policies that address the inequalities and the harmful social and the cultural norms in South Sudan. We also need to center the adolescent girls and the young women in all our efforts and make sure that there are strong systems to protect their safety and rights in their ability to access prevention and treatment services without fear. Thank you.
Thank you. Minister Motsoaledi, as Betty is reminding us, we're on the road to 2030, where it was hoped that by 2030, 5 years from now, we can eliminate AIDS as a pandemic. So what can South Africa commit itself to?
Well, we said we are going to eliminate it as a public health threat. By that time, it doesn't mean it will be gone completely, but it will no longer be a public health threat, which it is now. And we are not just dreaming. As I'm saying, there are pointers to that. Number one, UNAIDS gave us a guidance and an instrument called 95-95-95, where 95% of people must know their status. We are already at 96. Where 95% of those who are HIV positive must be on ARVs. We are still at 79. And where 95% of people who are on ARVs must be virally suppressed, such that they are no longer transmitting the virus. We are already at 94. Now, on the 25th of February, we launched a program called Closing the Gap to look for 1.1 million people who are known to be HIV positive but are not on ARVs. And there are people who are skeptical about it. We have broken that number of 1.1. It's not a thumbsuck number. These are people who are known, who have got records of, who have got names of. Some of them with addresses, even though they are changing. We know them province by province. Each province has got the number of what you are looking for. We know them by district, and we know them by facility. Like this morning, it was reported to us of the number of people which this hospital alone is looking for. And so we have already started that. Once we find them, we'll be on 95, 95, 95. That's the first thing. The second thing, don't undermine the announcement made by Global Fund in Geneva yesterday about this issue of lenacapavir. I'm repeating, it's a game changer. Only if we make sure that it reaches especially young adolescent girls. And that's what we are going to be doing. And I've already said here to some people that while we know that there are key populations, etc., 90% of what we want to spend on lenacapavir is these young girls, because they are the ones who are at risk more than any other person. And so once we reach 95, 95, 95, and you provide lenacapavir, and we are not saying we must forget about other things like condoms, etc. I'm not saying that. I'm just talking about the new entry with lenacapavir. Then we'll be on the way there. It just needs our political will and our determination and our working together.
Madam Winnipyanima, you're going to have the last word. This was your global update as UNAIDS together, obviously in partnership with SANEC. So you've spoken a lot about global solidarity, looking beyond non-traditional funding methods, working within communities. But what is the real thought you want to crystallize in our minds?
The main message from our report is that there is a funding crisis in the HIV response, and we must find ways to plug that. What I've said, or what our report says to the developing countries, to countries like here in Africa, is that reprioritize, find ways to put some more into HIV because there's a big hole, but also find ways to increase your cost effectiveness, how you do this, when you're integrating, how you do this. And that brings me to the Reverend's point. By the way, I like your jacket. The point that communities are an important way to deliver service, meaning girls, young people delivering to themselves, LGBTQ people to themselves, sex workers to themselves. This is the success of the HIV movement, that services were taken from the facility into the community. So to governments, we are saying, as you find ways, one of the most cost-effective ways of reaching people is to work through the communities. So that's key. And because this is a global launch, I have this message to the rich countries, is that, look, aid is just one resource flow. It is declining, we see that. And it was always with many challenges of paternalism, of the kind of problems even the minister mentioned. But there are other resource flows that countries like Africa, low-income countries, are denied because of the actions of the richer countries. They must address them. Let me give you an example. In 2023, Africa received $72 billion as aid. 72 for agriculture, climate, whatever, and health. 72 billion. But Africa lost $88 billion in illegal financial flows, most of it tax dodging by companies taking money back to Europe and America. So 88 went out, 72 came in. Even more, Africa paid $101 billion towards debt repayments, principal and interest. That debt, the interest is so high because of external factors, not because of Africa. So we're saying to the rich countries, do the right thing, agree on a way to restructure debt quickly to free resources for our countries to put in health systems. Yes, we are saying negotiate and finish the tax convention, Global Corporate Tax Convention at the UN, to close these loopholes of tax dodging, where the revenues we should collect from those who make money here are being lost. We need that convention quickly. So to the rich countries, it is maintain the aid, but the real resources are to unlock money that's caught up in paying debt and in resolving the issue of tax dodging. Thank you.
Quite poignant and powerful. I want to thank our panel for lending us your time and your insights. A summation from where I sit, Professor Helen Rees, the Executive Director of the Wits Institute on Reproductive Health and HIV. You've reminded us data, research, it matters in setting policy and in coming up with innovations on the treatment side. And those innovations can be a breakthrough, as we heard yesterday, and we should pursue those goals. Betty Wani, coordinator of the Adolescents, Girls and Young Women Network in South Sudan, you've reminded us that statistics are not numbers. They are volunteers working in advocacy. They are young women who can't negotiate their sexual rights. They are communities ravaged by war, and that collective of problems compounds the treatment and the HIV response. Minister Motsoaledi, the Honorable Minister of Health in South Africa, you've said unequivocally the principal responsibility is for governments to provide for their citizens. External support is helpful, it's an auxiliary, but first the government owes it to the people to come up with the response, and you're committing to the people of South Africa, and then after that to the world as part of the global solidarity. Reverend Mbulelo Diasi, Executive Director of the SA Network on Religious Leaders living with or personally affected by HIV. You've said that people living with HIV in South Africa know that there are funding problems, but they are determined to live regardless of those problems. You will mobilize in those communities. Yes, there's faith, but you're going to believe in the science. Less fire of false prophets and more science and interventions by the state. And Winnie Byanyima, Executive Director of UNAIDS, the global financial architecture is skewed unfavorably for least developed countries, but there are non-traditional methods We've started to see it in 25 nations. We're starting to see it regardless of those PEPFAR cuts. It's not always a money solution, but it's a political will solution and a global solidarity solution. We thank you for taking the time to be here. We welcome you to South Africa, and let's get this done by 2030. Thank you, ladies and gentlemen. I've been asked to request that you all stand for a group picture carrying the report as well. Thank you. I think you can give them another applause.
Really an amazing panel discussion, and I would also like us to give Sis Lerato. What happened to her, Lerato? Yes, congratulations. Thank you so much. Thank you so much. I think we got a gist, a very clear gist, that where there is a political will, there's a way. Despite the way we started 2025 with the shaking in terms of the financial support to the HIV program, we also had severe cuts in terms of prevention, and that is stated in the report. But it's also stated that governments need to elevate the prevention agenda, and what better time than now, as the report says, when we are on the verge of a prevention revolution with Lena Kepava. Can we all say Lena Kepava? Lena Kepava. We will hold the minister accountable. He has promised that every young girl that deserves access to Lena Kepava will get access. This is a twice yearly injection that prevents HIV acquisition. And when the government is offering to take it up, we also need to be thinking sustainability, and that is where the issue of local manufacturing comes in. So thank you so much, Minister, for that commitment. As you know, SANAC is a multi-pronged structure. We are composed of the private sector, civil society, and government. And the third arm of SANAC, which is the SANAC Private Sector Forum, was launched in 2021 under the former Deputy President Babuza. And this forum, the partnership is to make sure that the response in terms of HIV, TB, and STIs is truly multi-sectoral. We had amazing things from our faith-based leaders, and we are really relying on our private sector partners to help us in terms of leading the innovations, finding the efficiencies. And we are going to get a message of support from the SANAC Private Sector Forum, representing the SANAC Private Sector Forum Chair, Ms. Mpumi Zikalala, is Dr. Tutula Balfour. Dr. Balfour, thank you.
Thank you, Program Director, and good afternoon, ladies and gentlemen. I will acknowledge our Minister, Aaron Mutsaledi, and the UN Executive Director, Ms. Winnie Byanyima, and then all protocol observed in the interest of time. On behalf of the SANAC Private Sector Forum, we extend our heartfelt appreciation to Ms. Winnie Byanyima and Dr. Tembisile Xulu for convening this critical launch of the UNAIDS 2025 Global AIDS Update. The report, AIDS Crisis and the Power to Transform, arrives at a pivotal moment. The global HIV response is facing unprecedented challenges due to the disruptions in international financing, and this is what we heard this morning in that excellent panel that we had. These shocks threaten to reverse decades of progress in prevention, treatment, and care, and risk derailing our shared goal of ending AIDS as a public health threat by 2030. Yet, in the face of adversity, we are inspired by the resilience of countries, communities, and civil society. South Africa's leadership in HIV research, its vibrant activism, and the strength of its community networks continue to illuminate the path forward. The Private Sector Forum stands in solidarity with these efforts and reaffirms its commitment to being a proactive partner in the national response. We recognize that sustainable progress requires bold and innovative financing strategies. The private sector has been actively engaging in dialogues to explore how best to step up its contributions, financially, strategically, and through shared expertise. We are committed to leveraging our platforms, resources, and influence to support the national AIDS response and ensure no one is left behind. We also take this opportunity to acknowledge the impactful work already being done by the private sector in various industries. The mining sector, through initiatives such as the Masoisa Health Program, has demonstrated how workplace-based interventions can significantly contribute to the national HIV response. These efforts have been made possible through strong collaboration with the United Nations system, including support from UNAIDS, the International Labour Organization, and the World Health Organization. Beyond mining, other industries such as transport, health, retail, and banking have also stepped forward with meaningful contributions. From workplace wellness programs to community outreach and awareness campaigns, these sectors are helping to extend the reach and impact of the HIV response across the country. Furthermore, the private sector has been an active participant in private-public partnerships with several companies, SANAC PSF members, working closely with provincial and local governments to coordinate and strengthen the HIV response at the grassroots level. Recent examples include the co-funded outreach campaigns funded by Afrocentric, Seriti, and Exaro. This collaboration is a testament to our shared commitment to a multi-sectoral approach. The recent establishment of provincial private sector forums in South Africa marks a significant milestone in our journey. These forums are a bold step toward a more localized and responsive HIV strategy, ensuring that the private sector's contributions are aligned with the unique needs and dynamics of each province. We believe these platforms will be critical in sustaining momentum and driving innovation in the years ahead. As we gather today, let this launch be a call to action. Let it remind us that transformation is possible when we unite across sectors, borders, and communities. The SANAC Private Sector Forum pledges to continue working hand in hand with government, civil society, and international partners to build a future free of AIDS. Together, we have the power to transform. Thank you.
Thank you so much, Dr. Balfour. So honestly, the recent global funding disruptions threaten to reverse hard-won gains, and it's exciting to hear partners like the Private Sector Forum saying they are stepping forward and saying not under our watch. Coming to communities, the report makes reference to how for more than 40 years, communities and community-led organizations and networks have shaped and powered HIV programs across the world, saving countless lives. The impact and cost-effectiveness of community-led interventions is evidence in a growing body of research, as we see with the programs that are even being implemented in South Africa. We in SANAC have a community-led sector. We've got a SANAC Civil Society Forum, and we are all in agreement that when communities lead, HIV responses succeed. Without meaningful and significant involvement of communities, the HIV response will fail. So on behalf of communities, I'd like to call on Ubabsoli Ndugu, who is the chairperson of the SANAC Civil Society Forum, but also the co-chair of SANAC, to give his message of support. Bele. Thank you, Tata. Thank you.
Amanda! All power to all the people. Ngiyabonga. Thank you very much, Sis Anna and Mayor Tembi. The esteemed global partners as led by Comrade Winnie, our honored leaders of the country as led by the Minister Honorable Motsoaledi and Honorable Litsige, the leadership of the civil society in our country as led by the First Deputy, Comrade Sheila Mbele-Khama, the private sector as led by Comrade Tutula Balfour. Greetings all, comrades. Today, as we launch the 2025 UNAIDS Global Report, I speak not only in my own country, South Africa, but I speak to the people across the globe, to those living with HIV, to the mothers, fathers, young people, carers, and communities who carry the weight of HIV epidemic. To each leader and policymaker whose decision will shape the future. I speak to all who believe in the world where everyone can live with dignity. UNAIDS has been at the heart of the global HIV response. working with us as civil society, ensuring that our voices are heard, our expertise is respected, and the needs of the communities we serve are prioritized. We appreciate this partnership. But today, we must face the truth. The numbers in this report could look very different in a year or two because of the decisions world leaders have already taken this year. And the choices they will make in the coming months. Choices that will decide the fate of millions. Across the world, we are seeing cuts on HIV funding, and the civil society, as Professor just alluded to, we stand ready. As civil society, will continue to lead in our communities. But we need world leaders to match our courage with commitment and our hope with resources. We call on world leaders, donors, and all who have the power to act. Fully fund the Global Fund in its aid replenishment. This replenishment is not just about financial commitment. It is the lifeline for millions of our people. It is about the solidarity. We are seeing a rising anti-rights movement that threatens safety, health, and the dignity of key and vulnerable populations. If we do not act with urgency, we will see new emerging challenges. We'll see new infections rise. Treatment access will fall, and millions of lives will be put at risk. As civil society will not wait for change to happen, we will drive it. Over the coming year, we will strengthen our accountability systems, we'll improve the quality and accuracy of our committee-led monitoring, we'll amplify the voices of those who are left behind. We will work to ensure that data does not simply reflect statistics, but drives action in every sphere and in every corner of our communities and at every level of decision making. We will deepen our partnership with young people, key populations and networks of people living with HIV, ensuring that our leadership is inclusive and effective. We will do our part so that when we gather next year, we can report progress that is real, measurable, and felt by the communities we serve. Let us remember, behind every number in this report, there is a human story. Behind every number in this report is a child with a dream for tomorrow. Behind every number in this report, there is a young woman who wants to live without fear. Behind every number in this report, there is a family who wants to see their loved ones grow old. We have the science, we have the expertise, we have the tools. What is needed now? It is leadership. What is needed now? It is political will, it is investment in people, and respect for human rights. Let us stand together to ensure that when UNAIDS launches the next global report of 2026, it tells a story not of loss, but of victory, not of inequality, but of equity, not of despair, but of hope fulfilled. Let us end AIDS together. Aluta. Continua. Thank you.
Thank you so much, Babsoli. I envy you that when you came up, they were singing. Now there's no singing for me. But in any case, we go to our next speaker, so thank you so much. In 2023, together with our sister agencies, UNICEF and the World Health Organization, with many stakeholders and partners, community organizations, particularly organizations of women living with HIV, we launched the Global Alliance to End AIDS in Children because of a real indictment that our numbers, our data told us. Our data showed us that where we were averaging, Minister, 75% in terms of our treatment achievements for adults across the world, children, we were reaching children barely 60%, between 50 and 60%. So imagine this. We as adults are receiving the treatment and we're leaving behind our children. And so this Global Alliance to End AIDS in Children was launched and has made major progress. 12 countries in Africa were identified that were countries that were showing the highest numbers of children living with HIV, and South Africa, alongside those 12 countries, launched the Global Alliance here. And I want to invite to the podium Mrs. Humile Mashatile, who is the Second Lady of South Africa, but also the patron of the South African Global Alliance to End AIDS in Children, to share with us progress and give a message of support. Welcome.
Thank you so much, program directors, the CEO of the South African National AIDS Council, Dr. Thembisile Qulu, and the regional director of UNAIDS, Ms. Anne Getitu Shongwe, Honorable Minister of Health, Dr. Aaron Motsoaledi, Honorable MEC of Health and Wellness in Gauteng, Honorable Nomantu Nkomo Ralihoko, Deputy Minister for Women, Youth and Persons with Disability, Mr. Steve Letsike, Executive Mayor of Ekurhuleni, where I come from, Ms. Ngosi Ndiphe Xhakaza, UNAIDS Executive Director, Maweni Biaima, thank you so much for being here. UNAIDS Country Director, Ms. Eva Kiwango, thank you once again. Chairperson of SENEC Civil Society, Mr. Sole Ndugu, and his Gauteng Chair, Ms. Gladys Shabalala. Representatives from the SENEC Private Sector Forum, Dr. Tutula Balfo, Wits RHI Professor Helen Rees, CEO of the Nelson Mandela Children's Fund, Dr. Lindy Nkomo Ngube, PEPFAR Country Coordinator, Ms. Saisa Johnson Qureshi, development partners present, the hospital CEO, and all departments of health that are currently present. Development partners also present, ladies and gentlemen, and everyone watching online all around the globe. As patron of the South African chapter of the Global Alliance to End AIDS by 2030, I'm honored to join you at this pivotal moment for our children and our nation. It gives me great pleasure to deliver a message of support at this launch of UNAIDS 2025 Global AIDS update. AIDS crisis and power to transform. The 2025 Global AIDS Report shows how some progress has been made in the HIV response globally. 55% of all children living with HIV globally have received antiretroviral therapy in 2024. This was an improvement, actually, on the coverage of 17% in 2010. In 2024, there was a 62% drop in vertical transmission global since 2010, the lowest number since the 1980s, which was a remarkable achievement. And yet, even as we celebrate, we must confront the truth. Just over half of the children living with HIV globally are not receiving treatment they need. That means hundreds of thousands of children, including many right here in South Africa, are still waiting for care, waiting for justice, and waiting for us. According to the UN AIDS report being launched today, although these achievements have been impressive, they have been uneven. Globally, about 12% of all AIDS-related deaths in 2024 were among children, even though children accounted for only 3% of all people living with HIV. An estimated 120,000 children still acquired HIV globally in 2024. The vast majority of these children are in the sub-Saharan Africa. More than 620,000 of the children living with HIV globally were not receiving antiretroviral treatment in 2024. As we reflect on these numbers, let us all remember that behind all these numbers are children, a child in a classroom, a child in a clinic, a child in a mother's arms. There's a name, there's a story, a future that hangs in the balance. But this is not a burden, it is a call to action. And it is one we must answer with everything we have. I'd like to reiterate the words of the UN's Executive Director, Ms. Winnick, when she said, "The HIV response was forged in crisis, and it is built on resilience." In these challenging circumstances, our HIV responses, our adopting and our government in the global south are rising to the challenges to ensure that women are not acquiring HIV during pregnancy or in the postnatal period, to make it easier for pregnant or breastfeeding women to access and use long-acting methods of PrEP, to encourage male partners to test for HIV so that appropriate precaution can be taken, to do better at diagnosing children living with HIV and providing them with more palatable pediatric antiretroviral medicine formulation, to support communities of women living with HIV, such as mentor mothers, to continue the crucial work we do, to protect the community-led programs, to continue to play their critical role to deliver cost-effective, person-centered services, and to lift the barriers of access, such as stigma, discrimination, and gender inequalities. Let me be clear. This is not a gap in policy or funding alone. It is a gap in will, and we must close it. As patron of the South African chapter of the Global Alliance to End AIDS in Children by 2030, I stand before you today and to say that we cannot let another child fall into the cracks. We cannot allow recent global funding challenges to unravel the hard-won progress we've made. The price of resilience is simply way too high. I call upon every sector, from government, the private sector, to faith-based organizations, civil society, and the media, to rally behind this mission. Let us invest in solutions that are not only evidence-based, but community-driven. Let us reach the mothers who hesitate to seek care. Let us train workers who stand on the front lines. Let us embrace the children who need our protection. Ending AIDS in children by 2030 is not a slogan. It is a promise. A promise that every child, regardless of where they are born, deserves to grow up healthy, happy, and HIV-free. And as history turns its gaze on us, and it surely will, let us be remembered as a generation that stood tall, the generation that did not flinch, the generation that kept its promise to its children. Because when the children of the future look back on this moment, let them say they cared enough to act. They believed enough to care. They loved us enough to end the fight. In conclusion, I'd like to thank the various stakeholders who continue to play the role in HIV and AIDS response. Our Minister of Health for his commitment to implementing government policies and for providing healthcare to all our people. Thank you so much, Minister. To donors and development partners, we thank you for your continued support. But we also ask for you to also stay the course. Your investment changes lives. Now is the moment to lean in and not pull back. SANEC Private Sector Forum for your invaluable contribution to South Africa's HIV response, including continued leadership and commitment by mobilizing the power, innovation, and resources of businesses to complement national efforts in preventing new infections, improving access to treatment, and reducing stigma. I extend my deepest gratitude to our healthcare workers, who are truly the backbone of our country's healthcare system, and the unsung heroes of our collective HIV response, who tirelessly dedicate themselves for, unfortunately, most of them in very difficult circumstances, and have saved lives. They provide us with hope and brought dignity to countless individuals and families. And that's one part in our aspects that we need to appreciate our healthcare workers. To Mawini Baiba, UNA's Executive Director, and her team as well, thank you for your unwavering leadership and steadfast commitment to the global HIV/AIDS response. Under your leadership, UNAIDS continues to play an important role in driving people-centered, right-based approach to ending AIDS as a public health care threat. Thank you so much. Thank you also for your tribute you paid for our former president, David Mabuza, and the former chairperson of SANEC. Lastly, we continue to recognize the government of South Africa for its leadership in the country's response to the HIV and TB epidemic. As we reflect on this important report, let this be the moment we recommit with urgency and with unity. We have the tools, we have the science, we have the partnerships. What we now need is to accelerate the action with urgency, with compassion, and unshakable commitment to every single child everywhere. Let this be the turning point, where words cannot result with strategies becoming services, and where promises made become promises kept. Nyabo, thank you.
Thank you so much for me. Thank you so much to you, Mrs. Mashatile, patron of the South Africa Global Alliance to End AIDS in Children, for your profound comments and your championing of this amazing work. Thank you. And now, for a very long time, whether you lived and resided in South Africa or you lived somewhere else in the world, the SANAC was synonymous with my sister. This sister of mine has been an incredible activist on so many fronts, whether it is fighting for women's justice, or it's fighting for LGBTQI rights, or it's fighting for young people, or it's fighting for children. Wherever there was an opportunity, there is an opportunity to fight, she is there. And now is an activist deputy minister. I don't know how that's working out, but we know you to be in civil society, so Deputy Minister of Women, Youth, and People with Disabilities, Steve Mapaseka Nitsike, I want to invite you to give us a message of support. Here's the song, here's the song, here's the song. Woo!
Tulamdana, Tulamdana, Tulamdana. Amandla, Amandla. Viva SANAC, viva. Viva UNAIDS, viva. Viva people living with HIV, viva. Amandla. No, thank you so much, program directors. What a warm welcome. Dr. Shongwe and Dr. T. I want to really appreciate the Honorable Minister of Health, my colleague, who is coming back and has come back in this department, has championed this work, and I want us to give him a round of applause. Let me appreciate our UNAIDS Executive Director. We know South Africa is your home, Mama Winnie. Thank you for hosting this event in South Africa, because indeed, the title of this report that speaks about AIDS, the crisis, and indeed the time to look at transformation is now, and it is a good time to host this event in South Africa. Thank you. Let me appreciate MEC of Health in Gauteng. Let me appreciate the Second Lady, who's a patron, but also who's a champion for children in South Africa. Thank you so much for doing this work, Mrs. Mashatile. The Executive Mayor, who's also here with us, for hosting us here in Ekurhuleni, a very important metro, as the Honorable Minister has said. The leadership of SANAC, the co-chair, as well as chairperson of civil society, you brought with yourself here leaders of civil society sectors. My regards to you and the entire leadership. Let me appreciate private sector. Doctor, please continue to be innovative, but also to mobilizing private sector to bring resources into the space. Now private sector needs to show up. Now more than ever, it is time. And we want to see that happening. Let me send regards to all leaders who are here. Dr. Helen Rees, a dear friend of ours who's been in the front line for many years, so thank you so much. I am here to do just a simple job, and mine, of course, is to introduce the Honorable Minister, and maybe before I do so, is just to say three things, Honorable Minister. Indeed, Mama Winnie, the road to really ending HIV as a public health threat by 2030, we are still on it. The time is ticking. It doesn't stop. It is in time of crisis that this country showed leadership. It didn't show leadership only here in South Africa, but it showed global leadership. And I think we pride ourselves as South Africa to having achieved that. This was not done only by government. It was done with the communities, with the people living with HIV. And this is why we have the biggest HIV treatment in the world. And our prevention effort is upscaling, but also the partnership in terms of responding to the very same pressure points of human rights. We continue to show leadership globally, not only even in the HIV response, but in all other fronts, including building solidarity with the people of Palestine, with the people of South Sudan. I saw Betty. We continue to doing so in South Africa. And we have the honor. The former deputy president that we are paying respect to was a special envoy to South Sudan and Uganda. And the current deputy president, Mr. Mashatile, is the special envoy to South Sudan as well as Uganda. So we will continue to build solidarity as well in that base. So I want to really say, just quoting those statistics again, 40% of decline of new infection is key. And we will continue doing so. And I think Minister has said that during the panel. 56% of death have declined. People are living longer, stronger, and they are contributing to the economy of our country. We have done this work because there has been dedication of communities. Minister, when you came in 2009 as Minister of Health, you were transformative in the approach. We've put HIV treatment into the biggest numbers that we've seen today. But we've also put our prevention agenda by virtue of continuing to test people. You've done this during the time turning around what we have denied ourselves as South Africans. But we can do it again. 2025, we are in our 5th generation of the NSP. The midterm of the NSP, Babunduku, Dr. Kulu, must say, what do we do in the time of financial distress? We must be able to say, what is our priority in this midterm towards 2028 when we end the NSP now, so that we are not caught off guard in that. But last point I want to raise, this disruption that we've had globally is not only just about the people and the business we are interested in, because we are in the business of saving lives. It also disrupted the backbone of the health system. The many healthcare workers, the many community supporters, the many technical providers everywhere. Here in South Africa, in our neighboring countries, this disruption disrupted livelihoods. So when we are building solidarity about the healthcare system, the treatment, the commodities, we must also think about the people who have been working in the system, because they are disrupted, and we must consider how do we save those jobs, because they remain important. We are not going to relegate people just to volunteers and think we will end HIV as a public health threat. We must also think about the economic circumstances and their livelihood. So those are my words. So I want to really ask you to help me welcome a champion of the health, a politician who has been in the space for many years. He's my senior politician. Even if we sit in the NEC together, he remains my senior politician. A comrade who's also a medical doctor, known to many of us for his passion and for what he's actually championing now. And Minister, I can tell you, without fear or favor, we will continue to fight for NHI until we get it in South Africa. So I want us to really rise, Honorable Minister of Health, and to give us a message on behalf of government and on behalf of our President. Magwala acheche le morao, hoya rona bapelote. Lisang magwala acheche, hoya rona bapelo. Hoya rona, Asiligwal.
Thank you very much. Thank you very much, program directors. Thank you very much, Steve. You actually rattled me because I spent the whole morning sitting there and speaking. I thought when my turn comes, I'm just going to say, thank you very much. Now you have given a promise that I'm going to give a big message for the government. But I want to start by saying acknowledgements and protocols have been observed very thoroughly by the First Lady, the Second Lady, who I'm also acknowledging, and also acknowledging Mama Winnie, acknowledging my colleague, Steve Litsike, and my colleague, MEC Ngomorale Hoko, and acknowledging the mayor of the district where we are, and the co-chairperson of civil society. Let me stop there and say protocol observed to all of us. As I said, I've already spoken for a very long time, but I just want a few messages. Message number one, we have come too far to turn back. We have come too far to turn back in this battle against HIV and AIDS. And come what may, we are not going back. That's what I want to promise. I don't want us, after this long journey, to suddenly lose courage and as some people did immediately after this withdrawal from PEP, that we're going to die. There were already numbers of people who were being counted who are going to die. I don't really like us to go that way. And I was very happy when Reverend Diase here was telling us, we're not going to die. We're not going to. We're going to hold on. Because we can't reverse our gains. If we do, it means even the money we have already spent, we'll have wasted. It means so. Whoever is listening around the world, because I heard that Mama Winnie, we have connected all over the world. I want to remind the world, or to tell the world, about what one of the main funders, philanthropist, Mr. Bill Gates himself said. We're at the African Union, and one journalist asked him, he said, Mr. Gates, you have contributed a lot of money for polio. We all know the amount of money all over the world he has contributed for vaccination against polio. And he said, you have contributed a lot, and polio is being eliminated. The war is about to be won. She never said, the journalist was a lady, she never said the war is won. He said the war is about to be won. Why are you still spending money on polio? Why don't you stop and look at other very pressing issues and spend your money there? I like the answer I heard from Bill Gates. He said, if I stop now, I will have wasted all the money that I spent before because we have not yet arrived there. So it's like an athlete running the Comrades Marathon, which is run in South Africa every year. There's no other country that has got a Comrade Marathon. We're the only ones. And you saw what happened there, running that 90 kilometers. If you have run that 90 kilometers and just 1 meter before you reach the finish line and they fire that gun, you're not going to be counted among those who won the Comrade Marathon. You haven't arrived. Yes, so that's what Bill Gates meant, that we have not yet arrived. It's not time to turn back. And so we can't turn back. The second message I want to send. This year, for the first time in 20 years, the replenishment of the Global Fund is going to be here on our continent. This very continent that is crying, that it has lost everything. Here is an opportunity. The Global Fund replenishment has taken place every 3 years in other countries. Now, for the first time, it's coming here. It is going to be hosted by our own President, Cyril Ramaphosa, or rather co-hosted by our own President Cyril Ramaphosa, and the Prime Minister of the UK, Prime Minister Keir Starmer. They will be here hosting that. And that is our first test, Mama Winnie. And so this message is to world leaders. Here is the test to see whether after what has happened, we can do something that proves that we should not turn back. Dr. Tutula Balfour, I'm also sending you to the business people around the world. I mean around the country first, around the country, because you represent them, to business people around the, this is their time to shine. In September, when we are doing this Global Fund replenishment, to show that we are resilient. Now, here is something very surprising, but let me say disturbing, not surprising. World leaders, especially in Europe, have been told that they must invest their money in war. Yes. They are disinvesting in social development and health and economic development to invest in war. Who are they fighting with? Or who is fighting who? Yes, because we have already got snipers that in September the Global Fund replenishment might not be. We have already been warned. Remember, we're the host. We have already received snipers of messages that don't expect what used to happen in other years because we're investing in defense. Defending ourselves against who? Who is starting these wars? And so the message to world leaders is this: no one has ever won a war on this planet, because after every war there are talks. Why don't we start with talks? Why do we destroy first? Have you seen all the buildings that have been destroyed around the world? Buildings that took ages to build, they get destroyed within a second is down. Within a second is down. And then we are going to come and rebuild again. So these wars are not helping anybody. And so I want to leave them with a message. A statement that impressed me. That was said by one of the most eminent scientists. After the US dropped bombs in Hiroshima and Nagasaki, Albert Einstein, the most eminent scientist, said, I do not know what weapons are going to be used to fight the Third World War. But I know the Fourth World War is going to be fought with stones and sticks. We already see this, yes. Basically, it was meaning if we fight the Third World War, everything will be destroyed. If there had to be a Fourth World War, only stones and sticks will be left. Do we want that type of the world? So please, world leaders, think again. Invest this money in development. In development, social responsibility, health, education, economic development. If you do that, you will be stopping war. You are not going to stop war by investing money in war. It's not going to happen. And so, in September, show that we can stop war and invest in social development. Thank you very much.
Thank you, Honorable Minister. Another round of applause, please. Thank you. Siyabonga, Minister, thank you very, very much. And thank you so much for the political will and the guidance. I think the Minister has been clear that forward we go forward. Forward we go forward. There is no going back. And I say this because I'm reading the report. As I was standing here, I'm reading snippets. It is possible to reverse the gains. And it is possible to see rises in new infections. So when I look at this report, it says, new HIV infections in the Middle East and North Africa increased by 94%, in Latin America by 13%, and in Eastern Europe and Central Asia by 7%. So we dare not be compliant because new HIV infections have risen in at least 32 countries since 2010. So we can't afford that. So we are happy that we've got champions for Lenacapavir in terms of prevention. I was proud when Deputy Minister Letsike launched the war on teenage pregnancy day before yesterday. Please give her a round of applause. I think we are all familiar with the triple threat that faces adolescent girls and young women. Teenage pregnancy, new HIV infections, and gender-based violence. And I think we can stand proud in South Africa and say, we are led. We are led. Shani izandla bazalwane ningasabi. We are going to ask Ubaba Uxhakaza, the Executive Mayor of Ekurhuleni, to please come forward and then give us a vote of thanks. And then I'll ask my co-chair just to make the announcement on the lunch. Please.
Backward never. Forward ever. It's a slogan just to affirm our resolve. I want to acknowledge Honorable Minister, ever passionate, and I want to lend the passion and the vibrancy to the DM, Steve, and the Imama, our MEC, and the patron, Ms. Humile Mashatile. And maybe let me also observe all the protocols. And I think it's important that I acknowledge the Executive Director of the UNAIDS, Mama Binyama. Winnie Binyama. And ladies and gentlemen, it is both a singular honor and a moment of proud reflection to deliver the closing, the vote of thanks at today's launch of the UNAIDS global report titled AIDS, Crisis and the Power to Transform. And we are really grateful that you chose us, the city of Ekurhuleni. We do think that these conversations are impactful at a lower level where it matters most. We host, we're home to about 4.2 million population, and where we are in Germiston, there's a diverse, society, the demographics, and the impact of age is quite prevalent. So we gather this afternoon not merely to witness the publication of a document, but to confront a shared history and to recommit ourselves to a collective future in which AIDS pandemic is no longer a defining feature of our global and national landscape. And hosting this global launch of the report in the city of Ekurhuleni at the Beta Goa Hospital, CEO Lebu Kumalo, and the Beta Goa Hospital, a facility named after one of our most fearless advocates for justice. It is not it is not accidental. It is symbolic. It reminds us that public health is inherently political, that access to life-saving care is a matter of equity and human dignity, and that our communities remain the front line of both crisis and transformation. And the report challenges us. It compels us to look beyond the statistics and to listen carefully to the lived experiences of millions who continue to navigate the realities of HIV and AIDS. It urges us to see that while science has advanced, progress remains uneven, that while treatment is available, access is unequal, and that while the end of AIDS is within reach, it is not yet guaranteed. And indeed, the crisis persists, but so does the power to transform. That power lies in our health system when there are adequate resources and community services. It lies in our public policies when they are grounded in evidence, guided by compassion, and unapologetically inclusive. And it lies most profoundly in our people, particularly the youth, the women, and the vulnerable communities who continue to lead from the front, often with little recognition, but immeasurable courage. As a city of Ekurhuleni, we affirm our unwavering commitment to this cause. We are strengthening our primary healthcare infrastructure, scaling up HIV prevention and treatment programs, and working closely with the grassroots organizations to combat the stigma and misinformation. We are prioritizing the health and well-being of adolescent girls and young women, recognizing that structural inequalities remains one of the greatest drivers of the new infection. And I think, Mamuini, we take, we've had, when we're doing the walkabout, when we're asking questions about youth-friendly health services, and that's sort of a commitment that we've made in some of the clinics that we own to emphasize the youth-friendly clinics in particular. But we are also clear-eyed about the magnitude of the task before us. The end of AIDS will not be achieved through words alone. It will require bold action, sustained political will, and deep social solidarity across all sectors, across the borders and across the generations. I wish to express our sincere appreciation to the UNAIDS for its leadership in placing this report within the global spotlight, and for choosing Ekurhuleni to host this significant moment. Your partnership reinforces our conviction that cities and local governments have a central role to play in global AIDS response, not as passive implementers, but as active architects of change. Let us live here today not with a sense of closure, but with a renewed sense of responsibility, let us rise to the call this report makes to transform our institution, our communities, and ourselves, so that the future generation may speak of AIDS not as an ongoing crisis, but as a hard-won victory of humanity over indifferences. Together we can build a future that is more just, more equal, and ultimately AIDS-free. I want to thank you for the opportunity. Thank you very much, Program Director. Backwards, forward.
Forwards ever, backwards never. And we will remember you, Mayor of Ekurhuleni. Thank you so much. We have come to the end. We have come to the end. There are over 1,000 people online across the world, 1,000 people. So if you haven't had a chance to, or you want to go back and play a piece, you can go to UNAIDS, go to YouTube, you go on X, you go on LinkedIn, you will find us, you will find the recordings of the day to be able to look back and pick out your favorite piece to go over it again. We will now have a break for lunch, but first let me invite the speakers to come on stage again for a media huddle. No, we're not asking you for another speech, Minister Motsoaledi, but we really enjoyed your speech. We liked your statements, we loved them, and I know the media does too. So we just wanted to please invite you all to please come up for a media huddle, because we're going to have some interviews. We're going to try and figure out how we do that with lunch as well. I was looking for the CEO to invite you to lunch, but I understand lunch for our dignitaries is to the right, immediate right of the stage. For all our guests, further to the back, there are tables right there at the corner to the right, as my right as well. You're invited and welcome to lunch. From us at UNAIDS, and on behalf of us and SANAC, and all of those who've been organizing, those who are in the back of the room, everybody who's been involved in organizing, thank you so much. Thank you all who've participated. On behalf of my co-program director and I, thank you. Thank you so much. Hambani kahle.